Let's take a quick look around the rest of the world. What's the closest nation in the world that comes to the United States in terms of what it spends on health care? Switzerland. They spend about 10%. Rumor is that France may pass them this year, but 10%. Most nations, including most Western industrial democracies, spend between 6 and 8% of their gross domestic product. And by the way, they have universal care for all their citizens. So we're at 17%. Now, we're told in this budget battle that the reason that we're at 17% of Medicare, we can't afford this program. It costs too much. Well, is it that we can't afford the program or have the costs associated with all of those industries become high? Of course they have. Let me just, and don't take it from me, Reuters did a study in 2009. In that study, they said that there is more, and this was a conservative estimate, than $700 billion annually. Now remember this, $700 billion annually in fraud, waste, abuse, inefficiencies, duplication, lack of health information IT, lack of technology, lack of integration, and rising costs that stem from end-of-life decisions where there isn't the consultation with the family and a doctor. $700 billion annually. That's why our costs are so high. So, wouldn't it make sense to attack that problem? Because it's healthcare costs at 17% that drive up the cost of Medicare. So rather than trying to balance the budget on the backs of people and seniors and create a dual system that CBO, that's the Congressional Budget Office, says is not workable, that ends up saying we're going to give you a voucher, and follow the thinking on this, I give you a voucher. The voucher is less than you currently get for Medicare. CBO says it'll cost probably every American some $6,000 additional dollars out of their pocket, provided A, that you'll be insured, B, that all those costs don't continue to rise. So how does giving you a voucher control the cost of the insurance company, of the pharmaceutical companies, of the medical device companies, of the hospitals, of the doctors, or of the trial bar in defense of medicine? They don't. So, in my mind, however well-intended or not, this is a false issue in terms of where we have to attack. Now, Kevin's right. Medicare is in a crisis because of those costs. How can we be at 17 and everybody else be between, on average, 6 to 8? Well, you know why we're at there. Because we haven't had the controls. Because we haven't squeezed out in this system what we need to do with respect to these companies. And that's where I believe that Congress needs to work together bipartisanly to solve this issue. Not to balance it on the backs of the elderly, and to make a program that's there for the future. And what if in that process you have to pay a little more if you're under age 55? You ask any American today if they have a guarantee on their health care to know that it's there for them, they're going to opt for that guarantee. But in the meantime, we have these enormous amounts of money. Modernization of health records, $77 billion. Cracking down on health care fraud, $60 billion. Preventing avoidable infections, that go on in hospitals all the time, would happen, $50 billion. Simplifying records. IBM from Connecticut was in my office and just said, one simplification of a record for Medicare and all the bureaucratic nuance that it costs saves something on the average of $68 billion. These are incredible, and then coordinating the kind of care that will allow us to have seamless coverage and floating of data and records and information. These are all doable without ending a program. Look, I get it. Grover Norquist and those who believe the government ought to be shrunk up so small you can drown it in a bathtub. There are people, right or wrong, and I respect people that disagree with me who say, look, everybody ought to be able to pull themselves up by their own bootstraps. Everybody should be a rugged individualist. Everybody ought to be able to tend to themselves. And if they can't, they should rally their families around one another. Until we look at the vagaries of the system and catastrophe and what can happen, whether at birth or by accident. The reason that people under a constitution form a government is so that when the vagaries of a system that we live in come crashing down around people who, through no fault of their own, find themselves out of luck or out of money, that we provide for them. And you do pay for it yourself as well. And that's why we're fighting so hard in Washington, and I believe winning, to make sure that we preserve the Medicare system as we know it for future generations as well as this nation. Now, Paul Ryan is to be credited for forcing a debate and making an issue clear, and that allows Americans to take a look at the costs and to take a look at what is needed.